I'm Doris, a sonographer practicing in the UK, and I go on lives every day from 8 p.m. UK time. And we discuss about practicing in the UK as a sonographer. We discuss about registrations, career, finances, and everything in between. And everything in between. Right, so we're just gonna wait for a while and get some people on the live. And on this live, I just want to get some Q&As about sonography and the HCPC registration in the UK. Because funny enough, if you go through the regulated professions by HCPC, you wouldn't see sonographer there, right? Yeah, you see physio, occupational therapists, and the law. There are 15 regulated professions, but sonographer is not there. But anytime you apply for a job as a sonographer, if you see any advert, oh my god, it's so hot in the UK right now. It's crazy hot in the UK. So you see, they are always asking HCPC registered, HCPC registered, and you begin to wonder, yeah, you're now wondering like why are they talking about HCPC registration, whereas sonographer or sonography is not among the protected titles by HCPC. So just want to clear some questions. Just have a list of questions that have been asked in the past, and I'm just going to go through it, and we'll see how we can get on from them. The first one is, can you register as a sonographer with HCPC? And the answer is, you cannot. Can't not. Counting down not. At present, you cannot register with HCPC exclusively as a sonographer. You cannot register with HCPC as a sonographer, right? All right. I have my little human here who doesn't want to be let down. So we are here together. We're on this life together. We're living our dreams together. She says no, she wouldn't let go of mommy. All right. So as a sonographer, you cannot exclusively register with HCPC, right? Because you are a sonographer. Yes. If you're wondering why, it's because you are a sonographer. And if you go through the regulated professions in HCPC, it goes to their website. Please stop that. Can you stop that? Thank you. If you go through there, you see that there's no you see that there is no sonography there that is being regulated as a profession by HCPC. So you cannot exclusively register with HCPC as a sonographer, because sonographer in itself, that's a big grammar David. Let me read it from you, word verbatim from the website. Because sonography, the title itself is not legally protected in the UK. So that is from the British Medical Ultrasound Society. And they are top notch when it comes to information about ultrasound in the UK. All right. That's the first question I get most often. Can I register as a sonographer with the HCPC? The answer is no. Now you know why. The other question I always get is, oh, I'm a nurse. Can I practice ultrasound in the UK? Oh, I'm a physio. Can I practice ultrasound in the UK? And the answer is yes. Happy you. Yes. Why? Because as a physiotherapist, you can register with HCPC. Register with HCPC, then get postgrad, right? Postgrad, please don't go suffer through the undergrad. Get a postgrad in ultrasound. Then you can now practice ultrasound as a physiotherapist. And please go to MSK. Just take it from me, more money. Go to MSK right away. Don't go dilly-dallying around abdomen. Go to MSK right away. The next question is, oh, I'm a midwife, I'm a nurse, can I practice ultrasound? I would like to open my own, get a more centered experience with my patients around their babies and do the ultrasound. And the answer is yes, you can. You can, please. Do a PG set in obstetrics, do a PG set in gyne, and you're fine. As you're registered with NMC, you can use your registration and practice. It's a little tricky too, but you can practice as a nurse, right? Practice sonography as a nurse. You can. The next question is, who can practice ultrasound and do not hold HCPC registration? Huh? Sonographers who enter the field directly do not need HCPC registration. What I mean to say here is, you can practice ultrasound without having HCPC registration. Why? Because you studied ultrasound from your undergrad. And with your educational background in ultrasound only, I apologize for my little human, but she's not going anywhere. And I am also leaving a promise to myself to be on live today, right now. So I'm not going anywhere too. We are here together. If you miss any information, just leave me a question and I'll get back to it. So you can practice ultrasound without HCPC in the UK if your educational background is in ultrasound, because with that educational background, you are not eligible to register with HCPC. So, chicken and egg. I hope that makes sense. All right. The next question is, can I be employed without HCPC and ROCT? So this tallies with the previous question, which is yes. You can be employed, but you have to have an educational background and a clinical experience to practice. Otherwise, what exactly are you doing there? Yeah, free will, Danny. Free will, Danny 8, MI5. Yes, that's what is in my head. I want to read MI5. That's what is my head. MI5 and MI6. Oh, I love those movies. Now, the next question is that I get a lot is there a shortage of sonographers in the UK? And the answer is yes. Yes, there's a shortage of sonographers in the UK. Yes, it is a very profitable profession. And to me, I've been doing sonography for 10 years now. I've practiced in 2 continents. So it is a profitable profession, like regardless of where you are. And I don't believe that we have exploited the profession enough yet, like when it comes to the monetary terms, like how you can benefit from it financially as a profession, as a job, in the sense, like we haven't explored that enough. So it's really a good profession, and there is a shortage in the UK. The next question is sonography a high stress job? Like, I don't understand why people are asking these questions. Is there a job that is not high stress? I don't think. To each their own, and each day is different in sonography. Each day is different, and I'm sure with every other profession, each day is different. At some level, you're dealing with human health, you're dealing with human emotions and different people every day. Yeah, the stress level is there. But as a sonographer, you need to learn to control yourself and you'll be fine. You see, you're just pulling out all of these white wipes, you're destroying them. So that is that. Next question is, why do people quit sonography? To the best of my knowledge, most people quit because of the mental load and the MSK injuries. Like most people have tendonitis, inflammation, shoulder pain, bursitis, things like that. Those are among the first two great reasons why people quit. People just get like mentally drained because of overwork. Some people are just, the injury takes them out of the game. So you need to always, every 5 minutes I do this. I do this. And I scan with my left hand. And I always make sure to like take short breaks all the time to ensure that I am not having my hand or my shoulder in one position for a very long time. So this helps a lot to keep you in the field for long. Most people don't make it up to 10 years in sonography because the injury is real. It's real. Your shoulder, your thumb, this thumb, oh my god, this thumb. And then you're moving patients, your back, your leg, your feet. You're always on your feet. You're doing portables. You're, oh my god, you're running around the hospital with your feet. You ever walked in a big hospital and you have to go around and do portable? And then you're on call, you can't rest at your home, and you're just worried if your phone will ring, if things like that. So those are the few things that get people out of the field early. Those are the few things that get people out of the field early. So that is that. And my daughter for me. Hi. So those are the few things that get people out of the field. Yes, I think I have done the questions that I have written down. So if there are any other questions, just let me know. Any questions you have about sonography and practicing in the UK. So there's also a question about RCT, but tomorrow I'll be on live at 8 o'clock UK time, and we'll discuss RCT registration for sonographers who have the educational background overseas. Yeah, those who studied overseas. It's always easier for those in the UK who studied in the UK, but those of us who studied overseas, there's a whole lot of documentation. So we'll go through that tomorrow, and we'll try to see how we can do that. Is anybody interested about how much sonographers make in the UK? Dun, 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 dun. And people always ask you, can I become a sonographer without a medical degree? People are always asking that, can I become a sonographer without a medical degree? And you can. You can. It depends on how you will navigate your career. It's all about the roadmap. It's really all about the roadmap. I've made a video about the roadmap to get yourself to the sonography job, regardless of your educational background and your degree, your medical degree or not. So you can get them. So you typically only need an associate degree or a bachelor's degree. And you can follow that up with some professional certifications. And so people are asking, is it hard to become a sonographer? Yes, becoming a sonographer is difficult. Please, can you sit down? Can you sit down? We need to coexist here. Just give me a few more minutes. Thank you. So yes, becoming a sonographer is considered difficult because it's really demanding. And hi, Hartley Vibes. Can you do a shout out, please? What does that mean? Say hi. 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 What do you need? You need me to say shout out to Hartley Vibes? What would that entail? Let me know. What would the shout out entail? All right, so becoming a sonographer is considered hard because it's ultrasound physics. You will not need the physics so much during practice, but you will need it to succeed ultrasound school. So if anybody is telling you that ultrasound physics, you don't need it, it's a lie. You need it to pass ultrasound school. But after school, everything that you need is incorporated in the machine. And your machine, you will set it up once and for all. And you only begin to change it few times, just depending on maybe patient habitus or maybe patient positioning and things like that. You don't really need it like a day to day, but it's really good that you know, because when you know how to calibrate your machine, you know what to expect, you know how to make some changes that will significantly positively affect your scanning experience. Yeah. So I would say it's hard. It's hard. The two main things I would consider hard is the physics and please, can you stop that? You're going to fall. Take the physics and the anatomy, ultrasound anatomy. If you have those two figured out, you're fine. I'm telling you. If you have your anatomy, human anatomy down, and then there's ultrasound anatomy. When you're done doing your anatomy and everything, you now go to ultrasound anatomy. That's well, when I studied, the course was called sectional anatomy, ultrasound sectional anatomy. That's where you study slides of ultrasound, like the liver, taken in the transverse, in the coronal, in the oblique, and you study all of those and know what appears how and where, what location, inferior, posterior, bilateral, and all that. So once you have that down, you'll find ultrasound it becomes part of you. It really becomes part of you. But to get into the program is really tough. That I will not take away. I will not take away that. I will not take away. All right. So I have another question here. What is the fastest way to become a sonographer? Oh, please, careful, Mama. What is the fastest way to become a sonographer? Now, the fastest way to become a sonographer is to just get a 2-year associate degree. That's the fastest way. 2 years associate degree. So you don't need to go through radiography and figure things out and all that. So just get a 2-year associate degree and you will be fine. You will be fine. And it's best for people, those who already have like a BSc in radiography, a BSc in those who already have a BSc in radiography. A BSc in radiography. There. So those who already have a BSc in nursing, a BSc in radiography, you can easily just get a 1-year PhD in ultrasound and you can start practicing as a sonographer. So that's the fastest way to become a sonographer. Fastest way. You either get an associate degree or a PG set 1 year. You're good. You're good. You're good. You're good. All right, I think we've covered all the questions I have here. If you have any other questions, just leave it in the comments and I will get right to you. See you tomorrow at 8 p.m. and we'll talk about the ROCT registrations for sonographer in the UK. All right, bye.